This is where the trust and really knowing and not hop, skipping, and jumping around to places, but really building a core relationship
with your
provider.
I agree.
Because they know your skin, they know what you want to get, and they know what you're using. You want a good cleanser, you want a good sunscreen, you want a really good moisturizer, but it's your treatment products that are really going to make a difference.
Welcome back to the Treat Different podcast, where we challenge the norms and reimagine beauty for melanin-rich skin. I'm your host, Fatou, nurse injector, educator, and founder of the Treat Different movement and Fatou Aesthetics. This podcast is where clinical excellence meets cultural awareness, and where we advocate for safer, smarter, more effective aesthetic care for Black and brown skin. Today's episode is a powerful one. We're diving deep into chemical peels, PDRNs, and the common mistakes made on melanin-rich skin that lead to post-inflammatory hypopigmentation and other complications. And I'm joined by someone I trust deeply, Melissa Evans. She's the founder of Beauty Hunters and a 25-year industry veteran who understands the nuance, the protocols, and the lived experience of treating skin of color. This conversation is more than skincare. It's about restoring trust, reclaiming confidence, and treating melanin skin with the respect and precision it deserves. Just a quick disclaimer before we get started. The information shared in this podcast is for educational and informational purposes only. It does not replace individualized training, certification, or medical guidance. Providers are encouraged to use their clinical judgment and refer to evidence-based standards when treating patients. Let's get into it. Melissa, welcome.
Thanks for having me.
You're very welcome. So, Melissa, can you share with me your journey into aesthetics? How did you become such a trusted authority and someone who also you not only been in the industry for so long, but you understand Black skin aesthetics. You understand melanin skin.
I think I was really lucky because in the beginning, I started really in that medical kind of field, working for some doctors who had some skincare lines, kind of at the beginning of their expansion. And I really got to learn from, doctors hands-on, which was great. And it took me everywhere, from whether it was the salon and spa industry, the medical industry, the surgical industry, or even like those big box Ultas and Sephoras that are out there. Yes. I've kind of covered it all. And through all that, people, I learned differently. And it also gave me a lot of exposure to the different types of people that are in aesthetics outside of just even the client or the patient, but the people that are actually doing it, whether it's an esthetician, a surgeon, a buyer who really knows nothing about skincare that much, or, somebody that really has a lot of knowledge. So to me, I always felt like knowledge was really powerful. I'm kind of a nerd like that. And I really, really delved, deep. I also believed in building really great relationships with all of my clients or accounts or whatever you want to call them. Yeah. And with that, I thought if I didn't know something, I, always went out and found out, whether it was from the company themselves or the doctors or, another account of mine. I really dove deep. And with that, I was able to pick up, as my time went on, pick up different lines. And to me, it's really important because it's not a one size fits all, no matter what Fitzpatrick type you are. Totally. You kind of, you can't just have miracles overnight. And as we all started aging, I'm not in my 20s or 30s anymore, different things become important at different times. And as you look at different Fitzpatrick types, I think that's what's really important, because how you treat that Fitzpatrick 1, that really fair person, is not the same as how you treated Fitzpatrick 6. And I think it's really, really important to understand stackable treatments and understand things that you can use together and how that truly affects different skin types, because, that's going to keep your patients more loyal to you.
Absolutely. Just providing the right treatment. Yeah. That's amazing. There's a reason why you are in this podcast today. I don't know if you remember, but you sat down with me in a difficult consultation before with a Black woman.
Yes.
She went to a provider who promised to deliver a certain result that was not the case. She came out with more problems that she went into, and was dealing with a lot of skin problems and large pores, dark spots, burns, until she ended up with me and found me. You happened to be there that day, and with her permission, you were able to be in that conversation.
Correct.
Yes. Yep.
Yeah, I remember.
Do you
her.
remember? Yes, you remember that day.
Well, and I think with skin, it's so important too because she was so beaten down.
She was.
And this is like who we present to ourselves. And I think I don't care who you are. Like everyone has insecurities, and she was really beaten down, and she was thinking that we couldn't solve her problems or solve her issues. And
she was done emotionally. Yeah. She didn't even
scared to try anything because she had not really, she'd not been able to find someone she could really trust, I think. So she just was tired of throwing darts at the wall.
Yeah, she was. And I've worked with you for the past 2, maybe 3 years, but honestly, that day, it really strengthened and deepened our relation and really increased my trust towards what you teach, what you do, because you're not just there for one type of skin, but you just understand the whole, which is like the 3 different podcasts. And Fatou Aesthetics, what I do is about like to really be able to deliver on all levels and to every patient.
Well, right, because that patient in particular, we really needed to get her trust before she was going to allow us to tell her what she needed. And I don't think she loved what we were having to tell her initially because we were not going to solve all her problems overnight. Yeah. But we could give her kind of a schedule or a treatment plan that would get her to where she wanted to be. And but I remember her because she was just so sad.
So sad. Yes, so sad. And from that day, because of that really, that conversation we had and that really dialed in consult, we were able to help her, keep her,
I think
treat her, and
about what you do is you talk to them. And I think that's the biggest key with anybody that's in this industry is really sitting down and talking to the patient. What is their expectation?
That made the whole difference.
It totally makes it. What is it that they want to see changed with them? Because something brings them in to see us. So what is it? What is their biggest thing? Because I got the best advice probably 20 years ago when someone said to me, somebody could walk in with terrible, terrible acne, and you're thinking, oh, this is an acne patient, and they're going to tell you they don't like their frown lines or they don't like their straw lines. So you really have to figure out what it is that brought them there and what it is they want to fix and what they're not happy about. And be honest with them and tell them and take them on what that journey looks like.
Yes. And that, once they trust you, that really building that trust before anything.
Correct.
Just building that trust. That's everything. What are some misconceptions you see? Okay, first of all, we're talking about peels.
Right.
And honestly, everything that I have learned from chemical peels, the correct layering, when you're doing, I didn't even know you could layer injections and chemical peels the same day. I did not know this. But this subject is very important to me, the topic we're talking about today. Chemical peels for dark skin, PDRNs, because not only, PDRNs, biostimulators, that's where aesthetics is going, but the fact that there are a lot of misconceptions out there about who can do a peel, what Fitzpatrick can you be to be able to do a peel. Let's start with busting some myth about chemical peels and darker skin tones, like Fitzpatrick 4 to 6.
So I think, first off, all peels aren't created equal. And I think that's the biggest thing that people, you can't just go in and say, I just want a chemical peel. You really have to know your ingredients. You really have to know your skin type. And you really have to know what you're trying to fix when you're getting that chemical peel. So most chemical peels were made based on for people that are basically a Fitzpatrick 1, 2, or 3. If people don't know what Fitzpatricks are, if you think of somebody that's from Ireland, red hair, blue eyes, that is like your Fitzpatrick 1. Your Fitzpatrick 6 would be someone who is a very dark African American, usually from Africa, very, very dark skin tone. Right. But even your people that are from the Middle East, from Caribbean countries, Cuba, Those are considered darker Fitzpatricks.
They have melanin.
They have melanin.
I recently learned that.
They do. And they
Wow.
have the issues that come with that, which is
Yes.
post-inflammatory hyperpigmentation. So you kind of can't take a person. That's why those intakes are so important, because you can't take a person by how they look, because there's very light skin Fitzpatrick
I
IVs,
love this so much.
and
Yes.
that's really important.
Yes.
So
someone can look like almost white, but still have melanin.
Still have melanin and still have.
So
right.
we need to ask questions.
You have to ask questions, and you have to ask, how do they sunburn? Do they what are the side effects? What have they had
Yes.
done before? Like, really ask those
and
questions.
even where are they from?
Where
Why
are they
not?
from?
Let's
What's your
not be shy
nationality?
away
Right.
from the what's
Right.
your nationality?
Right, because it's really easy
Absolutely.
to think like you know something, but those pre-take intakes are so important, and not every skin's the same. So it's knowing like on how to treat them. So first and foremost, not all chemical peels are the same. The other thing is it a superficial peel? So are we only looking to red carpet glow you? Are we only looking to exfoliate that top layer of skin? Because if so, you're not providing that much injury. But those truly, are not the best peels, because they're not going to be your corrective peels. They're not going to be the peels that's going to change the issues of what brought that patient in to see you. But, you have a wedding to go to, or you have something and you don't have a lot of time,
Right.
superficial peels have a great sense, of purpose that can be there.
Okay.
So the medium depth chemical peels, those chemical peels that actually go down to the dermal layer of the skin, are those corrective peels. So those are the
So
peels.
it has to be medium depth for
depth.
it to be
Corrective.
corrective. The superficial, only if you're looking to have no downtime,
Right.
just something
Hollywood glow.
Hollywood glow. Like, okay,
Right,
like
you're
you
gonna
went on a, maybe
Like your class reunion, or
Got it.
You got a wedding coming up or something, and you just want to look, more glowy.
More
you want to
glowy.
get that dead skin off you, because as we age,
Got it.
our skin doesn't turn over as quick. And I always laugh
Agree.
and say, if you think of when you have a newborn baby and the baby scratches itself,
Mm-hmm.
it heals probably by that night, because their skin is rapidly turning over.
Yes.
Grandma, she gets scratched and she could end up in
Oh,
the
it's
hospital.
gonna linger for
Right? It's going to
Yes.
be around for a really long time and can
True.
get infected, because
Totally.
she's not turning over. And we need to take that into consideration too when we look at how people heal and what people do. So corrective peels are really what's going to make that difference. That's where it gets tricky when we look at skin of color, because most corrective peels were made for those Fitzpatricks 1, 2, and 3.
Wow, most corrective peels.
Yes, so most are. So you need to make sure that you're dealing with a brand that was made to help with those darker Fitzpatrick types. And why is that important? Because chemical peels are kind of like an injury to your skin, for lack of a better word.
Yes.
And if you have skin of color has a big tendency to get post-inflammatory hyperpigmentation.
I agree.
That can come from whether they're having any, basically any type of inflammation. So too much sun, if they have acne scarring, if they have hyperpigmentation and melanin, production, all of that can kind of lead to PIH. So you really want to make sure that there are ingredients that are in those medium depth peels that cater to that clientele. And that's what's really, really important, because that's the biggest issue with anything that I see that we deal with skin of color is post-inflammatory hyperpigmentation.
It's true.
And if you talk to anybody that's a skin of color, that's their biggest concern too.
Oh, talk to me and I'll tell you. Yeah, that's
Right,
my
and they
biggest
think that
concern
you
when I
can't
do
have
any procedure.
Right.
It's post-inflammatory hyperpigmentation.
So you want to look at really good ingredients. And I think this is where the trust level comes in between the patient and the practitioner. And the practitioner and, the sales rep or whatever, is that really knowing what ingredients can help skin of color. So when you look at that, kojic acid is an amazing ingredient, and it works great for whether you're a Fitzpatrick 1 or a Fitzpatrick 6, because it works as that tyrosine inhibitor to help keep melanin from coming back. So we've worked really, really hard to get rid of all of our sun damage. Child of the 80s here, I had a lot.
Yeah.
We want to lift it out, but we want to keep it from coming back, because we
Yes.
still are going out into the elements and getting it. So where I might not get some post-inflammatory hyperpigmentation with it, that kojic acid is going to help me not get those brown spots back.
Yes.
But if I was a skin of color, kojic acid has an extra purpose to it. It actually helps skin of color from preventing PIH. And I think that's really, really important. I love glutathione. I think glutathione is an incredible ingredient. People are actually doing IV infusions of glutathione.
Yes.
It is a master
For the glow.
Yeah, for a glow.
Yes.
And it does. It provides a glow to the skin,
It
whether you're a
does.
Fitzpatrick 1 or 6. But what it does too for those darker Fitzpatricks
Right.
is it helps to fight. It's an anti-inflammatory, antioxidant.
It's an
going
antioxidant.
to really
Wow.
help fight, which means it's going to help heal, which is kind of like another little safe layer when it comes to doing peels with skin of color.
Yes.
And the other thing too is everybody that gets a chemical peel really wants to see that peel. They want to see themselves shed. I
Yes.
think that's another misconception when it comes to chemical peels.
Oh, let's talk about that. So everyone should not peel.
Everybody should not peel.
It's
and
not
you don't
safe
have
to always peel.
Right. And you don't have to peel. And I think
tell us about
think,
this.
I think if people say, oh, I'm getting a chemical peel and I didn't peel, it didn't work, completely not true. So I'm always a big believer you've got to take a picture. Take a picture before, take a picture after.
Yes.
Look at those straw lines, those uneven skin tones. Look at all of that. Because there's many reasons why you can't peel. Is it July in Ohio? July in Ohio is extremely humid. We hold on to more
Yes.
moisture. Our skin's
right.
going to have it.
So you're shedding, but you will not visibly,
visibly gonna see
that
it.
you're
Right.
shedding. You're peeling.
If it's February and it's super duper cold and you're in your house with forced heat, you're going to peel a little bit more. Your skin's drier. Again, we'll go back to our skin turns over every 28 to 78 days. We don't know when it turns over. So if you're on day 6 of fresh skin, you're not going to shed as much as if someone's on day 40. It's just, how it is.
That's right.
Do you use a lot of tretinoins and glycolics and exfoliators? Do you get treatments on a regular basis? If you do, you're probably not going to shed as much as somebody
someone
who
who
doesn't.
hasn't. Yes.
But
Makes
most
sense.
importantly, I could shed till the day is long. I never have to put anything on me. I'm a Fitzpatrick, probably 2.5. So
Okay.
I don't worry about post-inflammatory hyperpigmentation.
Right.
But if you are a Fitzpatrick 4, 5, or 6, I'm going to tell you actually,
Which is the darker
which is the
one?
darker skin, which
Okay.
is the darker skin type. So think African American,
Right.
Indian population, maybe Middle
Yes.
Eastern. I don't want you to peel. I'm going to tell you actually, we're going to put as much of our post-protecting creams on you.
So
We're
we
gonna
don't
put
peel.
Aquaphor so we don't peel.
Aquaphor.
Yeah.
Okay.
Or post-peel protectants, those hydrocortisone creams that
Okay.
usually come with chemical peels.
Yes.
We're going to use those because we want to keep that skin really moist. We
Yes.
don't want
While shedding,
While
you're shedding
shedding.
dead skin,
Right.
and correcting, but you're not visibly
but we
peeling.
don't want to pick it. We don't
I
want to
love
pull
this.
it, and we don't want it to accidentally come off because that's what gives us post-inflammatory hyperpigmentation. That's what's going to give us the brown spots. So that's the other thing when it comes to actually doing those chemical peels on a patient is you kind of have to know who your patient is, and because the take home is going to be a lot different, whether they're a Fitzpatrick 2 or a Fitzpatrick 5.
Yes.
So that's so I say that all the time. If you're a darker skin tone, I don't want you to peel. I'm gonna I'm gonna tell you to like really really protect that skin.
Yes.
And that's going to give you, the best results. And it's also kind of trust, the process because there's a lot of times too when people get a chemical peel where they're like, well, I look a little irritated. I'm a little red. I'm a little
Yes.
blotchy. Or, oh, my hyperpigmentation looks worse
It
before
looks
it looks
worse
better.
now. Yeah.
Yeah. And the only way we can get it out is if we lift it out. So that's sun damage. We get 80% of our sun damage before we're 18. We have to lift it out. To lift it out, it has to look worse before it looks better.
I love this.
Yeah, and that's why we recommend a series of peels. Same thing.
I was
with
going to say
acne,
because
scarring,
one
or
peel
anything.
is not going to do it.
No, it's gonna help stimulate some collagen and elastin. It's gonna take off that dead skin. It's gonna create new skin. It's gonna give you a glow, a more even appearance.
Okay.
But it's not going to fix those problems that we need. So, and everybody's different. If you have somebody that has melasma, that's where we come in, and I'm sure we'll talk about this later. Stackable treatments and why those are
Stackables,
important,
yes.
and how to do different things. Because if you have melasma, you're going to treat that different than someone that just has maybe some brown spots or age
Right,
spots.
because those take longer.
Those take longer, and it's chronic. So there's things that you need to do to kind of help it along. So that's kind of like the most important thing is really
awesome.
knowing your ingredients and really
Yes.
knowing like what, and setting the expectation to that patient
That too.
That, a lot of times people think like, well, this is what I'm doing. And it's we never got here overnight. So we're not going to fix it overnight.
Yes,
and this is the process of how we see to do it. I'm a big believer of take home products because if you don't do the maintenance program in
Yes.
between, then you're not going to get those results, that you want to get. It's kind of like brushing your teeth. You go to the dentist twice a year, but you
it's not
still got to brush your
there.
teeth in between.
Exactly.
And that's the same thing with skincare. I always say I wish someone in my 20s told me about sunscreen.
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 Same. I grew up thinking that I don't need sunscreen.
Yeah. Which is
no one told me about sunscreen.
Huge misconception for darker Fitzpatricks because they think that they don't get sun damage and they
because
think that
you
they
get protection from
your.
But it's not true. You need sunscreen.
Yeah. And if you ever put anyone that's a darker Fitz underneath like woods lamps and those cameras, I can't think of what they're called right now, but those cameras, you can see the sun damages that's there.
Yes.
It's the same thing where people don't think that African American skin or Middle Eastern skin is sensitive.
We burn from the sun.
But you burn and you're sensitive, and it's just as important.
Sensitive. Let me tell you what, this Saturday, I was at a graduation, and I was sitting at under the sun for about 2 hours. You know how I cover my hair? Here is cover, the rest of the face not cover. Even though I was wearing sunscreen and makeup over it, just because I was under the sun for so long, when I took off my scarf,
you had a line.
Oh, right away. Yeah. I can see the line so much darker, so much lighter under my scarf. And everywhere, it's like at least 2 shades darker than what I had covered. Well, real sunburn, real time.
And I think
sunburn.
That's like a huge fallacy is people do not think skin color can burn or be sensitive or
we
change.
Burn.
Right.
Yeah. And we need the sunscreen.
Yeah. And so everybody needs sunscreen. Yes. And I think that's vitally important for the skin.
So talk to me about the take-home care a little bit before we go to the next point. When you say the take-home is important, is it the take-home? Let me take an example with Perfect Derma, for example. I use Perfect Derma Peel. You introduced me to this, and it's great, like the kojic acid, the glutathione. And Perfect Derma is not paying me to say this. They did not sponsor this podcast, but let's say it. It's one of the best peels out there. It is great. I love it. But anyway, there is a home care kit that comes with it.
Correct.
Now, when you say the home care is important, when you finish with that home care kit that goes with the peel, which is for about 6-7 days, what do you do with your regular? Do you tell whoever, the audience that's watching, so when do you start your next, your regimen?
So basically, you're not going to do anything except for that take-home care kit.
That's all you're going to use
for the 6 to 7 days.
For the 6 to 7 days.
And those are a couple more acid towelettes because we want to gradually put that acid on so your skin peels off safely.
Okay.
And then we also give you a hydrocortisone cream, so we're protecting your skin and working at it healing. And we give you an SPF, which I think we just talked about on why we need that.
Yes, the SPF.
You are only going to use those ingredients for those 6 to 7 days.
Okay.
If you find yourself a little bit more irritated, a little bit red, a little stingy, because we're bringing that fresh skin to the surface, you can add some Aquaphor to it. But that's pretty much all I'm going to want you to add because I want you to, really allow the process to take care of itself. But then on day 7, ideally you're going to get these peels about once once a month for a series of 3. And then once you get their skin where you want it to be, you're going to go to once a quarter.
Okay.
Like a quarterly maintenance, program. Just to think, because our skin is constantly turning over, so we want to, we want to keep it turning over. It's our largest organ, and just because you have one doesn't mean this is going to be the skin for the rest of your life. Because again, you're going to have new skin within 70 days.
Within 70 days.
So you're going to think about it quarterly of getting this, done. You're going to want to start your regular skincare regimen back up on day 7.
Okay.
I think that this is where the trust and really knowing and not hop skipping and jumping around to places, but really building a core relationship with your provider. Because they know your skin, they know what you want to get, and they know what you're using. You want a good cleanser, you want a good sunscreen, you want a really good moisturizer, but it's your treatment products that are really going to make a difference. Yes. So do you have fine lines and wrinkles? You're going to probably want some tretinoin. You're going to want some retinol added into your life. Do you have a lot of hyperpigmentation, sun damage? Maybe you need a hydroquinone. Maybe you need just a good vitamin C product. Yeah. Eye cream. Everyone's worried about their under eye lines and their straw lines. That becomes really important. And I think that's where people can kind of then continue to see the differences in their skin, because that's going to help make the treatments that you're getting much better.
Yes.
So that's where it's going to be really, really important to put those products in. I do say start at day 7. I think is great.
Okay.
I think that's where you can
and
start
we're
with your
safe to start
exfoliating.
without like regular
Safe to
regimen.
start. If you're introducing something new to that patient, so especially if it's like a tretinoin or a hydroquinone,
Okay.
that's when I really recommend that we don't start to like day 10.
Day 10.
Only
yes,
for the
you
simple
mentioned
reason your skin's new. It can
Right.
be a little tingly.
Sensitive?
Especially if you've never had things like this before.
Totally.
So sometimes when you put on that new product, it's going to be a little bit more stingy, a little spicy,
Yes,
maybe.
spicy.
And sometimes that scares people off. If you wait till day 10, everyone's going
Right.
to be healed.
Yep.
And
we're,
everybody
like, that barrier
metabolizes things
is
different.
just
Your barrier
like
is back,
and safer.
you're going to be fine.
Okay.
But exfoliation, I think exfoliation is really good too. I don't think we exfoliate enough. I think that's like the biggest thing. And most fine lines and wrinkles is just dead skin cell buildup.
Yes.
So, and then it's interesting too, because as we talk about like skin of color, when you have somebody that's a lighter Fitzpatrick,
Yes.
when they start to age, that's where they see, more fine lines and wrinkles. I'm sure like, as you know, like if you're a darker Fitzpatrick, you see more dullness and sagginess than you see fine lines and wrinkles.
Yes,
and
I totally agree.
That's just a difference in how our skin,
We
how
age-
our skin
we
works
age
and
differently.
how we age.
Yes.
And that's why biostimulators kind of come in and why exfoliation comes in and why chemical
How often
peels
should
come
we
in.
exfoliate?
I think it's
darker
I think it's a
Fitzpatricks?
personal like choice. I think it's what your skin can tolerate. I exfoliate probably more than they tell me to. Only
But you're not worried about PIH.
But I'm not worried about PIH.
Yes.
And I've been in the industry for 25 years. So
Yes.
like I've put a lot of stuff on my skin. But I would think, at least probably 2 times, 3 times a week, is safe to just do
I
some
like
really
that.
good exfoliation for anybody. Every other day, start with that, like in the shower and do what works for you. Like, while I would love to say, yes, you should have a morning routine and a night routine, is that really truly possible? So at least if you can get it on once a day, I think that's what's really
I have very
important.
sensitive skin, and I exfoliate 3 times a week.
Yeah.
I think my skin needs that to really help my products.
It helps it absorb. Yeah. It's kind of like when you do dermaplaning. Like it's amazing on how your skin can help those products absorb more, or can help treatments absorb more if you don't have that, hair and dead
Right,
skin.
the
like
extra
on the
fuzz,
surface.
that's
right.
just,
That's there.
holding on to product instead of releasing it to your skin.
Right.
Yeah.
And opening up those little kind of microchannels in the skin really helps too.
Yeah.
But yeah, so I think like
Great.
exfoliation, I think is just, play around with it till you see.
Awesome.
Some people can use their tretinoins like every day. I really can only use it about every 2 to 3 days.
I think every 2 to 3 is
it's
pretty
just
good.
too much for me. But again, I exfoliate probably more than the average person too. So
Your skin looks great.
thank
Oh,
you.
it looks so good.
But
Yes.
vitamin C is something I use every day because
Okay.
I need to keep that sun damage away from me.
Do we need to use vitamin C during the day only or at night?
I think it depends. I think it goes back to, when are you going to use it?
Okay.
So like that's kind of like more important. I don't want it sitting on the shelf. If you're really bad at doing your skincare, regimen at night, then use it during the day.
Okay,
If you,
knowing
like-
that you're going to skip it at night.
Yeah. Like I would probably skip it. I know I should be doing a skincare routine at night,
But you do better during the day.
I do better during the day.
Okay.
So I make sure that I put all my actives on like during that daytime.
Okay.